So you have a new order for a medication and you need to give it subcutaneous. What do? What resources do you use? Well, in this video, we're going to talk about the Parenteral Manual to show you how it will help you cover your medication rights for best patient care. Right after this. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. Today we are talking about the Parenteral Manual, or Parenteral Monograph as they're called. This is a tool we use when we give medications by intravenous, intramuscular, subcutaneous routes. And it helps us make sure we're following our medication rights so our patient gets the safest care. So why don't we start with a medication order for ondansetron. 4 milligrams subcutaneous every 6 hours PRN for nausea. This is one example of a parenteral monogram. The first thing I need to check is that I have the right medication. And in fact, I do have the ondansetron monograph here. Working down the order of information on this monograph, we're next going to look at the right route. I see here that I do have an option of giving it intravenous, subcutaneous, or IM. My order is for subcutaneous and it says it is an available route. The required equipment and education, that is an important section to read in case you need to have an antidote available or you need to have monitoring tools available. Next, we want to look at the right reason. On this document, it's known as the indications. If you recall, our order was for nausea, and under the indications, I see that this can be used for a variety of situations where my patient is nauseated. Following along the monograph, we next have the right assessment. So we're looking at what would be a reason this patient could not take this medication, such as allergies, health history, drug-to-drug contraindications. Other assessment data will come down further in the document, and we'll return to this. The next thing in this document is age-appropriate dosing. So we're going to go past the neonates and the infants and go straight to the adults. Now we have several categories of dosing in here depending on whether it's chemo-induced or radiation therapy, post-op nausea, vomiting, prevention and treatment. What we're looking here is for, do I have the right dose? So we see there's a range between 4 milligrams up to 16 milligrams per dose. And it's mostly IV in this here section, or IM, but I don't see a sub-Q. So I may actually need to go to another document to find my sub-Q parameters, such as your drug guide, or maybe a patient-specific protocol. If I look at the geriatric population, I do see that there are some times and frequencies located on here, and it says at the subsequent dose box that doses can be given at 8 milligrams and maybe given 4 to 8 hours after the first dose. So I do have some information that helps me, but I don't have my subcutaneous information, so I'm going to keep looking. As I continue down to the dilution and administration text, I do see that there's a subcutaneous injection box. This lets me know that it is used for palliative patients who are or those who are unable to take it by other routes, and it will be injected undiluted. So I don't need to mix this in a saline or a sterile water. I'm going to simply draw it up and administer it. It also tells me if I give more than 4 mils, I need to use 2 sites. As we continue to move down this document, the next section is the adverse events. This section helps to inform our patient education and our evaluation. We can see that the most frequent complaints include headache, constipation, and flushing or warmth. We want to make sure our patient knows this so that they don't get too anxious if it does happen. Similarly, we would ask about these things when we assess them at the half hour, at the hour, at the 2-hour mark, whatever it is your time frame is for evaluation. Now don't jump over this clinical implications. This is another box that helps inform our assessment phase. One of the first things we want to make sure is that the IV site or subcutaneous site is in fact healthy. It also indicates we should be looking at their electrolytes, their liver function, anything to do with intestinal obstruction, and ECG monitoring may be needed if they take other medications that can prolong that QT interval. This will inform your assessments to make sure your patient gets the safest care. The product description, reconstitution, and stability box gives me information as to how my medication is packaged, how it needs to be stored, when it expires, and what solutions it would be stable to dilute in. So as you can see, there's a lot of information, but we're not done yet. At the very end of this document, we have our compatibility and incompatibility charts. If your patient has an IV infusing and you are administering this medication through the same line, or would like to administer it through the same line, you need to look to see if it is compatible. So for the purpose of this demonstration, let's imagine our order was for IV ondansetron and your patient has an infusion of furosemide already running. We would look first through our compatibility, looking for furosemide. I do not see it there. I'm going to go to my incompatible section, and there I see furosemide, which means these two drugs could not be in the same line because they will cause a reaction. They might cause some precipitate. So that means I need to then infuse my ondansetron after the furosemide and after the flush of that line, or in a separate line by itself. So you can see how well our parenteral monograms help keep us on track to using our medication rights for best patient care and safe outcomes. There are two rights on here we didn't talk about: the right to refuse, a patient can always say no, and the right documentation. You want to make sure you're documenting your assessment, your intervention, and your evaluation. That's our lesson for today. Thanks for sticking around. Take a look at some of the other videos I have and make sure you subscribe so that you get the next video when it's released. Until next time, have a great day.